Fire Away tackles burning questions and hot topics in Canadian employment law, human resources, and dispute resolution. Hosted by Rudner Law, Fire Away is your go-to source for legal insight on the world of work. So whether you are an employee or an employer, a lawyer or an HR pro, let's ignite the conversation and get into today's episode. Here's your host, employment lawyer, mediator, and founder of Rudner Law, Stuart Rudner.
Welcome to episode 97 of Fire Away. Today, I'm very excited to be joined by Donovan Pyle. Donovan is the founder and CEO of Health Compass Consulting. He's also the author of Fixing Healthcare. And Donovan was named the 2025 Benefits Advisor of the Year by the Validation Institute. Donovan is a thought leader. He's appeared on many podcasts, including today, apparently, and has been helping mid-sized businesses save an average of $1,856 per year per employee. I'm assuming that's American dollars. So right now, I think it's about $1 million in Canadian. So this is obviously a big deal we're talking about. Donovan, thank you for joining us today.
Stuart, it's great to be here.
I really appreciate you taking the time. And I guess I'll start off by asking you just to tell our listeners a bit about yourself, your journey, and how you end up doing what you're doing now.
Sure. So, I've witnessed and experienced the healthcare crisis from about four different angles. First, on the carrier side of the business, working for a large insurance company where benefits brokers were my customers. I saw some pain there, and I saw some things and opportunities that I thought existed on the brokerage side. So I went and jumped the fence and worked for a national brokerage firm. Very quickly realized that it wasn't the opportunity I thought it was. For reasons we'll discuss later on, and that what really incentivized me to start Health Compass Consulting in 2018. Health Compass is a management consulting firm that specializes in helping mid-sized businesses finance and procure healthcare more effectively. We give them the unbiased advice that they can't get from the brokerage community, and so that's really that kind of alignment is really the first critical step in unlocking a lot of value that's being trapped in healthcare budgets right now. And beyond that, I've been playing drums professionally since 1995, and I got to do that for therapy.
That's very cool. And if we have time, I want to come back to that. I'm always jealous of anybody who has musical talent. Whenever people ask me if I play an instrument, I say, yeah, CD player, which I guess now is dating myself because nobody has a CD player anymore. So I'm curious because you said, you are a consultant as opposed to a broker. And I know from watching some of your other podcasts you've done, you talked about, being a broker and the conflict of interest that exists. But most of the brokers that I know would tell you that they are being objective and trying to give the best advice. So how do you distinguish, a consultant as opposed to a broker?
Sure, great question. So let's just level set, especially since we've got a mostly Canadian audience here. Let's talk about American healthcare for a second, just in broad strokes, so we know the lay of the land. So in America, U.S. employers cover 164 million Americans with healthcare benefits each year. Last year, they spent about $1.3 trillion doing it. And here's the thing, though, about 25% of that, $325 billion of that was wasted. Okay, so that equals roughly $4,000 per employee per year in waste. And so to me, that is a massive opportunity. And really, that's the whole reason why my firm exists. And so why is that happening? Well, I think to answer that question, we have to understand this industry. Who does what and why? And how did these entities come into existence in the first place? So this is really why I wrote the book, because I saw so much confusion around this, between buyers and sellers as far as who does what and why. And so my book, Fixing Healthcare, is coming out November 2nd. And we've got a chapter just on the history of the industry, which I think, for a business-minded community, it is pretty fascinating.
That's, and I love, by the way, the fact that subtitle of your book, which I skipped over. The subtitle is How Executives Can Save Their People, Their Business, and the Economy, which is a pretty bold statement. So I love that.
It is. I think a lot of people are waiting on Washington, D.C. to do something to help them. And I've been watching this very closely for a long time, and I gotta tell you, don't hold your breath. Washington, D.C. is not, if anything, they're going to make things worse. So don't hold your breath. And you know what? We have the power. The private sector has the power to solve a lot of these issues. They just need clarity on the industry itself. And that once you have clarity, you can actually take action to solve a lot of these problems.
So I'm sure a lot of our listeners are wondering, okay, but we're in Canada and we have public health care, although of course most corporations and smaller businesses provide health care. So how is it different, and how is it similar to what you're describing?
Yeah, so in the US, we have a bunch of insurance companies that employers, I think, mistakenly think that they take on risk, that insurance companies actually pay for the hospitalizations, the labs, the imaging, the surgeries, the drugs. But in reality, it's actually the employer and the patients, the employees that pay for all this stuff. And there's a bunch of reasons why that dynamic exists, but let's take a step back. Stuart, let's go back to the year 1900. Can we?
I'm all yours. You lead.
Okay, great. So in the year 1900, the average American spent 1% of their income on healthcare, about $5 a year. All right. They spent more on cosmetics than they did on healthcare because here's the thing, back in those days, physicians couldn't really cure much back then. There wasn't really a whole lot they could do than just try to keep people comfortable. And so people didn't seek out medical care. All right.
Okay.
Now, as medical advancements came to the fore, as doctors became, underwent better training, as hospitals started to sterilize their rooms and add more equipment, the price of healthcare started to increase. Okay. And so no one had health insurance back then. There was no need for it, right? I mean, we're spending 1% of our income on healthcare. There's no need for it.
Yeah.
But especially during, when the Great Depression hit, hospitals were really stuck in a bind. That many of their patients were not able to pay for the services that they were receiving. And so what Baylor University Hospital did in 1929, they had a brilliant idea. What if we could get a large employer to prepay for our hospital services? Okay. So what they did
Okay.
was they partnered with the Dallas Teachers Union and they said, listen, for 50 cents per employee per month, all of your teachers can come in and have their babies at our nice, clean hospital here in Dallas. And so that was super successful. And
Okay.
and 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 other hospitals from around the country took note of that.
Okay.
Okay.
So
So part two of this is that this is the part that, a business-minded, audience will really love. These hospitals from other parts of the country, they actually put up the seed money to create health insurers, their own health plans. Okay. And these became Blue Cross plans. All
okay.
right. So you think about it, in a sense, they're investing in distribution of their services, right? Health insurers became wholesalers of hospital services. That's the
Right.
role they play, right?
Yeah. Yeah, which is fascinating. And I don't want to digress too far, but and I think you see it more in the States, but you see it here too. The cost of healthcare, or more specifically, the cost of privately paid healthcare versus insurance paid healthcare. And you get a bill that's sent to an insurer, it's like, $300,000. Whereas if you're paying out of pocket, maybe it's $40,000, something like that. I might have the numbers slightly wrong, but you get the idea. And how does that fit into this whole model of insurance and waste that you're talking about?
Yeah, so you bring up a great point. And so there was a fantastic study by the Rand Corporation that came out, I think it was 2019. Basically, the long and short of it was that in most cases, anyone who pays cash for healthcare gets a better unit price, a better price than a Fortune 50 health insurer. And there's a very good reason for it. It's because they want to. It's because they actually want to. And so again, when I mentioned that health insurers are wholesalers of hospital services, they both benefit from rising unit prices. Okay. And you got there's some regulatory things in the Affordable Care Act that happened in 2018 that really distorted this market even further. But as an employer, as an executive with U.S. based employees, you have to understand that health insurers and hospitals are partners. They are partners. We see this like faux fight that happens, this negotiation that happens in the media every 15 months or so over
Right.
contract rates. It's all smoke and mirrors. They,
Hmm.
at the end of the day, they always settle, and they always settle for a much higher price than what they were, what it was a year ago. And so this is at the root of why we have these massive inflationary rates in healthcare and hospital pricing. It is because of the perverse incentives that they live within. But hold on, we just talked about health insurers. 81% of businesses in the United States use a broker to help them maximize their investment. They expect brokers to help them understand what to buy, where to invest. And so there's a good reason for it. Most finance teams and HR teams don't have any technical training in healthcare finance or procurement,
Yes.
right? Right? It's just not what they do.
Right.
So like I love to tell people this example. When I don't want to have to worry about changing U.S. tax law as the CEO of my company. I mean, I look at it here and there, but I don't want to have to know every detail. So what do? I hire a CPA, and that
Exactly.
CPA works for me to
Hmm.
help protect my blind spots. But the problem in healthcare is unique because brokers do not have that same relationship. Brokers get paid by health insurers and pharmacy benefit managers. So basically, it's the equivalent to working with a CPA who gets paid by the IRS. I mean, it's so ludicrous. You can't even like fathom getting into that kind of arrangement. But yet, that's what 81% of businesses in the United States do, often unknowingly. Oftentimes they don't even know about the indirect compensation that comes from pharmacy benefit managers and insurance companies. Um, so this is really, again, why I wrote this book, because if you don't understand what your vendor's incentives are, you have no chance of managing your healthcare supply chain effectively.
So, and this is interesting. You know this, of course, better than I do. But I've seen, the reports or emails from brokers. Here are your three options or four options or whatever it is, and here's what I recommend. But I have never seen a broker disclose that they're getting any type of compensation from the insurance company. So I don't know if it's different in Canada and the U.S., but is that required anywhere?
Yeah, so under the Consolidated Appropriations Act of 2021, starting January 1st of 2022, all employers are required to know exactly how their benefits broker gets paid.
Hmm.
And yet,
Interesting.
in many cases, we're still we're seeing that a lot of employers don't even know that that's a requirement, let alone have the proper disclosures from their broker.
Right. And I have no idea, to be quite honest, if that is a requirement in Canada or not. But either way, I mean, your point makes it clear it doesn't matter because most employers don't know anyways. So I guess, brings me to the next logical question, right? So what are we as employers supposed to do then, as opposed to what we have been doing?
Yeah, so in my book, I lay out a six-step roadmap for reclaiming all of this wasted money. And and so the first step is actually the most critical, and it is to get unbiased advice. Because if you're not getting unbiased advice, you have no chance of getting to the second or third step. It's just it's just not going to happen. Now, Stuart,
Yeah.
you mentioned that there were, and I don't know the market up in Canada at all. I know it's a totally different animal, but there's a similar dynamic here in the States where, oftentimes legacy brokerage firms, and I'm talking about the, top 20 firms, will come to an employer and say, "Hey, here's a handful of options. What do you want to do?" Right? It's on a spreadsheet. The employer looks at it, oftentimes picks the cheapest option, and they move
Right.
on with their lives, right? I mean, that's kind
Yep.
of how it goes.
Exactly.
Okay, but here's the thing. If these businesses were actually getting unbiased advice, they would quickly learn that instead of the marketplace being this big with a few different options, it's actually massive. It's huge. Okay.
Yeah.
I mean, there are so many companies out there that are fighting for market share. There are 650 third-party administrators in the United States.
Yeah, so completely different in here. I don't know the numbers in Canada, but it's kind of like airlines. You guys have 20 different options. We have three. I think it's similar when it comes to benefits or insurers, I should say. But I think that's a fair point. The other question I was wondering is, I know, again, speaking personally, I've got my firm of 12, 13 people, and we provide benefits. And so it's pretty much what you're describing. Every so often I get the spreadsheets. Here's some different options. And usually we're not even focused so much on choosing the insurer, it's just choosing the package. And again, I don't know how similar or different this is in the States. Probably 5 years ago, we changed our approach somewhat in the sense that, before we were covering certain things, you had orthodontics, you had more massage, you had vision. And then, some people in our firm didn't need orthotics, some didn't need vision. So at that point, it was recommended, well, sort of reduce the built-in benefits, but add a healthcare spending account. So everybody gets X dollars a year they can use for anything,
Sure.
as long as it sort of comes under the broad brush of
Yeah.
healthcare.
Smart.
So is that, I guess the question is, does that help in any way in reducing waste?
Well, I think it helps you get more value for your money. I mean, the fact that you're using a funding mechanism that allows to pick up people to customize their benefits package to fit their individual needs based on their risk tolerance, their budget, etc. I think that's a very smart approach. Um, and this is the whole thing. It's like, I mean, basically, do employers need another commission salesperson sitting between this transaction? Is that what they really need? Because my thesis is that that's actually not what they need. What they really need are services. They need consulting services, they need procurement services, implementation services, and management services. And of course, as a smaller business, it's not as heavy on those things. But for more sophisticated companies, as a company gets more mature, and the ways that they're financing and procuring benefits and healthcare gets more sophisticated, all of these services become more important. So that was really the thesis for my starting Health Compass in 2018, was that at the end of the day, brokers who help their customers really maximize their investment are actually financially penalized in the United States for doing that. Right? So who wants to work harder to make less money? Nobody. Nobody.
So
And
that's the
so
problem with the model.
that's why it's so important to me that that the benefits industry makes this transition from selling products for commissions to selling services for a fee. Because this is the same transition that the 401k industry went through about 20 years ago. Okay,
Yeah, or yeah,
like when I
RSPs
came
in
up with my
Canada, same
revenue model,
idea.
I wasn't like reinventing the wheel. I
Right.
mean, there were
Yeah.
firms before me that have done that, and we saw a whole other industry that's very directly adjacent to the health and welfare industry go through this as fiduciary standards started being applied. And so, the reason that those fiduciary standards were applied and the 401k industry changed was that at the end of the day, the advisors were getting paid more to recommend certain products over others, and that's a huge conflict of interest.
Right. Yeah, and we've seen the same thing here. Your 401k is our RSP, same concept. Any financial advisor is getting compensated based on what they recommend. And here they're allowed to, but they have
Yeah.
to disclose it, of course. Now, I think you said you had 6 steps, and I think I may have sidetracked you after one. So do we need to go back? Did you want to finish
Well,
that
we
the series of
can, but
steps?
let's just double click on the first one here because I'm really championing this concept and idea of getting unbiased advice. But how do you actually do that? Okay, so
Yeah.
let's talk about that for a second. So that really there are two ways to do that. And for most, mid-market and small businesses, they're going to want to replace their broker with a management consulting firm who specializes in healthcare financing and procurement. And there's a small army of us that are, and a growing number of us that are in the market because people are like benefits people for the most part, they're passionate about this stuff. They want to solve these problems, but they don't want to be trapped in a system that doesn't actually reward them for doing that. Okay, so there's a small and growing number of these management consulting firms entering the market. In fact, you can go to the Validation Institute's website and see a list of them. Okay.
Yeah.
And
Yeah.
in full disclosure, I'm a senior advisor at the Validation Institute, just so you know.
Okay.
So that's the first way to do that. The second way to do it, if you're let's say you have more than 1,000 employees, is that you're going to want to start bringing more benefits expertise in-house. You're going to want to find these people, and put them on your payroll. Okay. And the ROI from doing that can be huge. Okay. I mean, this is for many businesses, healthcare is their second largest expense. It's the fastest growing financial risk on their P&L. And guess what, guys? There's no plan for like mitigating this. Most companies
Yeah.
don't even have like a multi-year plan or a strategy for mitigating this and controlling this.
Yeah. No, most of them go, like you said, they go year by year, they get the update and they spend part of a day thinking about it, and that's it.
Exactly, exactly, and that's proving to be not sustainable. So that's why like people like Mark Cuban have been advocating for bringing benefits expertise in-house. But again, that's only going to be economically really viable for companies of a certain size.
Right. Yeah, fair enough. So I guess maybe that's a good segue to where I was going to ask you next anyways. So what about for the smaller organizations? What should they be doing?
Yeah, so they should be replacing their broker with that management consulting firm. And here's the thing though, like in many states, and depending on the size of the group, et cetera, but a lot of the commissions that are embedded in these insurance products, they can be removed. So when the management consulting firm goes through the procurement process and is negotiating with carriers on behalf of the employer, because now we work for the employer, we're getting paid by the employer. Our job is to protect the employer from the insurance, so they don't get, they don't get bamboozled by the insurance companies and the
Right.
pharmacy benefit managers, et cetera. So, but when we go through the procurement process, we have the carriers net out all of these commissions. Okay. And so employers are surprised to find out. It's like, oh, I can get unbiased advice for about the same price as what my broker is getting paid.
Hmm.
Like they often think it's going to cost them so much more money to get unbiased advice. It's like, no, when you net out all of those commissions, oftentimes the consultant's fee is around what the broker was making anyway. I mean, of course there are
Right.
exceptions, but
Right.
that's
Yeah.
really why that works and why that's a viable solution.
Yeah. Well, if you can pay basically the same amount for unbiased advice as opposed to paying for biased
Yes.
advice, when you
Yeah,
put it that way, it seems pretty obvious.
100%. And just to put a pin on this for your audience, like when I worked at a multinational insurance company and benefits brokers were my customers, towards the tail end of my tenure there, my part of my job was to actually design the bonus programs for our top performing broker partners. Okay. So I
Yeah.
was literally the guy that was designing this bonus structure and for the top selling brokers, we would fly them around the world on luxury vacations. Okay? And we didn't do this out of the goodness of our hearts. We did it because we wanted them to recommend our products over our competitors. It was just par for the course. It was just what you do. Okay? I mean, we were a publicly traded company. We've got goals we got to meet. And so we've got to make sure that we get there. And so it wasn't about you know, we can't do that because we don't want to, undermine their objectivity and no, no, we're trying to undermine their objectivity. This is part
Right.
of what you do.
Yeah. And like you said, most businesses would not have a clue that was going on. So,
Exactly.
um,
And that's why the CAA, the federal rules were implemented because a senator from Tennessee read this guy Marshall Allen's article in ProPublica, which was basically an expose on all this backdoor money that was influencing how $1.3 trillion is being invested each year.
hmm,
Okay. And that's how that changed changed federal law.
interesting. So, I'm shifting gears a little bit because when I was checking out your website, one of the things that jumped out at me was you talked about blending creativity and strategy in employee benefits.
Yeah.
I mean, everything you've said so far makes a whole lot of sense, and to me, that's well, logic or strategy. Where does the creativity come in?
Yeah. So to me, business is art.
I got to remember that. Actually, I like that. I'm going to steal that from you.
I mean, it's not just spreadsheets. It's like, how do you come up with new productized services and how do you really get a pulse on what the market wants and needs and fill those gaps? I mean, I think there's a lot of artistry in how we run and create and build a business. And so again, going back to, my original thesis that what employers need are actually these different categories of services, right? Consulting, procurement, implementation, management services, and how we do that. In fact, my team just built a pretty cool product that we call Employee Benefits Voice, which we're launching this week. And it goes back to answer your original question, which was how do we know what our employees even value, right? The whole point of having these benefits programs is to help you attract and retain talent. How do you know you're investing in the right things if you don't have a diagnostic, quantifiable, framework for asking and getting that feedback from your employees? So we built a really cool survey methodology around this so that finance teams and HR teams can quickly execute and get a pulse on what do the employees actually value and what isn't being valued. And I'll be the first to admit some of the answers we see are quite surprising. Some of the things that people really value are not the things that cost money. They're not.
Interesting. Any examples come to mind?
I mean, I almost hesitate to bring this up, but pet insurance, like some populations love
Right.
pet
Yep.
insurance, and that's what they value. And so, sure, like in-house, HR teams might be hesitant to bring that on because it's another administrative task, and you got to reconcile the bill and all this stuff. But
Right.
hey, if people really value it, it's probably worth doing that work.
Yeah, look, absolutely. I know from my firm, my friends, like there are a lot of people who would put a huge value on that and would love the fact that their employer was offering it to them.
Yeah.
So it was a
I mean,
great way
yes.
to, like you said, attracting and retaining talent. That's the key point.
Yeah, it's oftentimes not the big, boutique customized health plan that we built with all these amazing pieces and features. It's having sometimes there's low-hanging fruit that we don't even consider.
And where was that tool that you mentioned that you people can use to figure out what their employees value?
Yeah, so we're going to be launching it tomorrow, and yeah, we're gonna share some links on LinkedIn tomorrow, and it'll be interesting to see what kind of reaction we get. But I think it's a tool that again HR teams can easily engage with and quickly get a pulse on what's going on, so they can make better decisions, and that's a really big deal. Like not to go off on a tangent here, but I will. Um, one of the things we're doing, businesses should be doing right now is establishing fiduciary committees for their health and welfare programs, just like they have fiduciary committees for their 401(k) programs. Um, and one of the big reasons for doing that is to make sure that businesses have an established process for making decisions. Okay. As an executive at your company, you're getting pulled in 50 different directions each day. And and if you don't have, meetings on calendars, a cadence, a process for evaluating, your second largest expense, you're probably not you're going to miss things, right? And inaction costs more companies more than anything else. Um, so
Yeah.
this is why we're establishing these fiduciary committees so that businesses have a better way of making decisions. Let's really know who has a voice and who has a vote, right? Just simple things, but it really makes a big difference because you get buy-in, you establish buy-in, and you can really make the critical changes you need to drive more value to the organization.
Right. Makes a lot of sense. And there was another tool that I saw mention of, I think, on your website. I wanted to bring up for the listeners the TBA, the Total Benefits Assessment Score. So maybe you can explain a bit about what that is.
Yeah, so a few years into our journey as an organization, we were delivering a consulting engagement to a pretty large company, and halfway through the CEO and butted in and asked the HR director, "Hey, is our benefits program getting better or worse?" Simple question, difficult to answer if you don't
Yes.
have data, right? If you're not quantifying the value equation of your benefits program. So what we did that, this was a problem that had kind of been rolling around in the back of my head for a while, but it really encouraged us to say, okay, we've got to solve this. This is such a like if we can't answer such a simple question, shame on us. That's terrible. So what we ended up doing was building a framework for continuous optimization, right? So what we do is we score companies into seven categories of benefits value, like strategic planning, cost control, employee satisfaction, employee engagement, benefits administration, benefits compliance, broker performance, like all these different categories of value and quantify how they're doing in them. And then we give them a nice report. And so they can see, okay, here's how you're doing again, compared to the benchmark. Here are the opportunities, and now you can say, all right, let's set goals based on this information. Let's develop roadmaps to achieve them, and measure moving forward.
I love that because as you're talking, I'm just thinking this gets back to what we often tell our clients and potential clients, which is at the end of the day, it's your business. You're going to make the decision. We want to help you make an informed decision. I'm always saying that from the context, of course, of employment law. But
Yeah.
what you said is exactly the same thing. And most businesses, as we said, they get a few spreadsheets, they get a bit of information, they make a benefits decision, they move on, and you're helping them to make a more informed decision.
Yeah, and you deal with this in a big ways as far as, how do people even define risk at the organization? What is risk to the stakeholders, right? When we're going to make an employment law decision, everyone has a different perception of what risk is, and and I would think it's probably super helpful to survey those stakeholders and kind of quantify who they are as far as some of these things goes. So
Yeah,
so that
no,
you
I
know who
love
your
that.
customer is. Because I mean, we've made this mistake where we thought we knew who our customer was, and we recommended one strategy and quickly found out, no, that's not who they are, and they're upset. And so that was again another impetus for really doing this kind of work, developing those frameworks for optimization so that these companies, we have better clarity.
Yeah, I think the clarity makes a lot of sense, and then, like I said, just helping them to make a proper decision based on unbiased advice. I mean, that to me really, really resonates a lot, and I'm curious now to look into exactly how the industry is regulated or not regulated in Canada. So I'll have to look into that separately.
Yeah,
Uh,
I can't comment on that, unfortunately.
yeah, fair enough. Before we kind of wind things up, anything else that you wanted to mention in terms of things that organizations should keep in mind or should be doing when it comes to their benefits plans?
Yeah, so I would say, let's just walk through the roadmap a little bit. So yes, make sure you're getting unbiased advice. At a minimum, understand where the conflicts of interest are so that you can, understand some of the biases that might be in play here. So unbiased advice. Secondly, quantify your current state. If it doesn't matter where you are as an employer, but take the total benefits assessment. Check it out. It's gonna ask you questions I guarantee you haven't been asked before. It's going to change the way you think about your supply chain and and give you some insight. So I'd encourage people to take that assessment on our website at healthcompassconsulting.com. And then from there, again, identify opportunities, set goals, and develop roadmaps to achieve them. And oftentimes that's going to require, an RFP process, a procurement process, and then some, potentially some changes. And that's okay. So, my message is really, listen, employers have the power to reclaim a lot of this lost profit. There are so many great healthcare strategies and solutions in the marketplace that most employers have no visibility to whatsoever. Okay? And they're all they get frustrated on the supply side. They're getting frustrated. Doctors are frustrated. They get 27 cents on every dollar, right? I mean, it's like
Really.
they're not happy either. So there's a lot of opportunities out there, but you just got to engage. I mean, it takes a little time to engage, but in many cases, the juice is worth the squeeze.
And if people want to learn more or even better work with you, what's the best way for them to find you?
Sure, they can go to healthcompassconsulting.com, or you can go to my personal website, which is donovanpyle.com, or you can download a free executive summary of my forthcoming book at fixinghealthcare.com.
Very cool. And actually, I did say I wanted to come back to this before I let you go. So you said you also played drums, and you didn't just say you played drums. You said you played drums professionally. So what kind of music and where do you play?
Well, I grew up in upstate New York, so naturally the first band you join as a teenager in upstate New York is a Grateful Dead cover band.
Fair enough.
I mean, it's all hippie rednecks and it's beautiful people. So that's kind of where that journey started. I played professionally in New York when I was living there in the city, and toured with a band for a while. Long story there, but yeah, done a bunch of fun stuff on that side of things. But yeah, it's good. It's good to use both sides of your brain. So I try to keep that going.
That's very cool. And do you still play professionally now, or now you play for fun?
Yeah, actually, well, both. But a few years ago, some colleagues of mine, we started a cover band, right? Classic rock, classic country, and we started actually to do a conference. There was a large conference that was coming into town. They want to showcase some local talents. And we said, you know what, let's make this a lot more engaging. Let's not just be a band that's in a room playing. Let's actually invite the audience to come sit in with us. Let's make it a little bit dangerous. Okay, so we ended up having 400 people at the Beecham Theater in downtown Orlando attend our first show. We had about 15 people sit in with the band. And I got to tell you, it was incredible because it was like, who knew that Bob from accounting shreds on guitar?
Mm-hmm.
And you could see Bob's colleagues, just cheering him on. It was unbelievable.
That's it. Well, it's very similar. It's every year the Employment Law Bar in Ontario does a fundraiser. And I was amazed every year at the number of my colleagues who are not only really good lawyers, but they can sing, they can play guitar, they can play drums, and yeah, just show to everyone a totally different side of these folks that they're dealing with, which is really cool. So
yeah, how we present ourselves on LinkedIn is not always the full picture.
Yeah, you should have a drum set in the background, actually.
Oh, hey, right here.
Just for viewers who are watching, we didn't plan that ahead of time, but that's very cool. And next time I'm in Orlando, I'm going to reach out so I can find out if you have a gig coming up, because that'd be really fun to come watch.
Oh yeah, please do. Absolutely.
Cool. All right. Well, we will wrap things up now. So that's a wrap for this episode of Fire Away. Donovan, thank you so much for joining me. It was a great and a really fun conversation. So I really appreciate it. And hopefully come back again at some point.
Absolutely. Looking forward to it, Stuart. Thanks so much.
Awesome. And I also want to thank, as always, our production team for helping to put the show together, and thank you all for listening or watching. If you found it helpful, please hit the thumbs up or subscribe, share with your friends and your colleagues. Also, check out the rest of Rudner Law's social media to keep up to date on employment law in Canada. And check out the book, Fixing Healthcare, which Donovan is holding up. And my eyesight is not good to read the subtitle. Oh, actually, How Executives Can Save Their People, Their Business, and Their Economy. I love that. So check out the book.
Go to fixinghealthcare.com, grab the executive summary. Lots of value there.
Awesome. And as one of my favorite hockey broadcasters always says at the end of a game, the pleasure was all ours.
At Rudner Law, we want people to treat their employment relationships as legal relationships and make informed decisions rather than assumptions. Keep up to date on Canadian employment law issues by following us on Twitter, Instagram, LinkedIn, and TikTok, liking our Facebook page, subscribing to our YouTube channel, and signing up for our newsletter. Past episodes can be found on YouTube, on our website, and archived on Facebook. And if you like our page or subscribe to our channel, you will receive notifications when the episodes are live. As we always say, none of that replaces legal advice tailored to your specific circumstances. If you think you might need an employment lawyer, you probably do. so please don't hesitate to reach out to us.